Hi, my name is Abby Rockers. Today is March 1st, 2018. I'm a 7th semester nursing student and I will be demonstrating how to place an NG tube, how to administer medication through an NG tube, and how to remove an NG tube. So I'd start off by walking to the client's room, providing privacy. I'd introduce myself. Hi, my name is Abby. I'm going to be placing an NG tube on you today. I want to assess for a few things. I want to assess if they'd have any kind of surgery in relation to the nose. I'd also want to make sure that their nostrils were patent, that they didn't have a deviated septum or anything like that, that their gag reflex is intact, and I also want to assess for their mental status and to see what their cooperation level is, because this procedure does take some cooperation on the patient's part. So I would verify the patient. I would ask for their name and date of birth. I would check that. I'd also verify the order, that I do have an order to place the NG tube. I would explain to the patient that when I'm placing this NG tube, that when it's advancing back, I'm going to have you first start off by extending your head backwards. And then once it hits the oropharynx, I'll let you know. And I'm going to have you extend your head forward, and I'm going to have to take some sips of water for me, okay? That water, the sipping of the water is going to help it go down easier and make the process a little easier for everyone, okay? If it becomes if it becomes too uncomfortable at any point, you just raise your right arm and let me know, and we'll stop and regroup and try it again, okay? All right, so once I had established that with my patient, I would want to assess the NURs, just to see which one was going to provide the most airflow, which one was going to be the most patent. I think the right one is, and that's on my dominant side, so we're going to go ahead and go with that. So once I had done that, I'm going to do hand hygiene, and then I'm going to place my gloves on to measure the tube here. So we're measuring this tube. We're going to do it from the nose to his ear, and then down to the xiphoid process, and then I will mark that. Okay, so like I said, it will measure from the nose to the ear, and then from that tip of the ear down to the xiphoid process. Okay, and so then I'm just going to place that with a piece of tape that I have ready to go, just so I will know that that is my marker. Okay, so once I have that ready to go, I'm going to go ahead and I'm going to lubricate the tip of the catheter 4 inches. And I'm going to place the curved side down. Take a deep breath and be ready to go. Okay, and then I would check in the back of the oropharynx. It is there now, so I'm going to have him extend the neck forward. I'm going to curve it 180 degrees, and I'm going to have him take a sip of water, advance it 2 to 4 inches, sip of water, advance another 2 to 4 inches, another sip of water, advance 2 to 4 inches, and I would continue to do that until I had the placement that I wanted. And we're almost there. All right, so we got it. I'm going to go ahead and secure this on his cheek for now, and we're going to ensure that we have correct placement on that before we would lock it in for sure. So 3 ways, hopefully that stays. It's not wanting to stick on the mannequin very well today, but that would stay while we tested. Okay, pretend it's staying. All right, so it's staying there, and we're going to test for 3 things. We're going to aspirate some gastric contents and check it with a pH strip to make sure that that lines up with stomach acids. I would also take a piston syringe, about 10 to 30 mils of air, and I would infuse it into the tube and listen over the epigastrum to listen for a whooshing sound. That would ensure placement was there. The 3rd way, which is the most definitive way, is actually by going and taking an x-ray. And so once the x-ray was here, they said that it's in place and we're good to go. I would go ahead and remove this, and I would secure it to the bridge of his nose. So to do that, I have cut separate strips here, and we are going to just go around the nose other way, and come around the other way to make sure it was secure. So now that it is intact and secure, I would also secure it on to his gown. I would leave enough room to where he could have a little freedom, but also just that it would not be straying away. So I would go ahead and pin that right there. And so once it was pinned, it was good to go. Sometimes it depends on policy protocol, you would hook it up to the suction. For now, I'm going to go ahead and leave it off because I'm going to administer medication. So I would come in, I would ask him his date of birth again, just verify that he is who he is. And I would also have done my 2 checks already on my medications. I would have made sure that they were okay to be crushed. And once I knew that they were okay to be crushed and they were good to go, I'd be ready to administer the medications. And before I got started, you would need to flush the tube with the piston syringe here. And before each medication, you would do a 20 to 30 ml flush. I would let that drain. And I would go ahead and administer my second medication. Or actually, this is my first medication. My first medication, rather. Again, using gravity to help that go down. All right. Then I would flush that one again with another 10 to 30 mils, just to make sure we aren't mixing medications. All right, very good. Do my next med. And I would be noting this whole time how he's doing with this administration to make sure that it's going okay, that he's tolerating it all right, and any notable information like that I would go ahead and document at the end. That was my last flush. So I would go ahead, I would clamp the tubing, I would resecure it to his gown, and be good to go with that. So I'll go ahead and take my gloves off. I would come back in to remove the tubing. So we're going to do that now. I would wash my hands, perform hand hygiene. I would make sure that I had an order to take the NG tube back out. And I would also let the patient know that I'm taking out. So we're going to go ahead and take your NG tube out, okay? And so I'm going to place some Kleenexes here by you in case you want to clean your nose off and your mouth off when it's coming out. We'll go ahead and do that. And I also didn't note, after I would do the medication administration, I would be sure to not hook it back up to suction for 20 to 30 minutes, or else it would suck all that medication right back out. So that's something that's really important to note with that too. And so with this as well, we're going to make sure that when if there's any kind of contents coming out, that they will have those Kleenexes there to wipe their nose off with. And also, I would make sure that they didn't do a feeding to about 20 to 30 minutes before I would take the NG tube out, or else that could be a bit messy as well. So I would make sure all of those things were in place. And then I would go ahead, I would also listen for his abdominal sounds and make sure he's not experiencing any kind of nausea or vomiting at the moment. And once I checked all of those, I would go ahead, I would put my gloves on. I would have my towel ready, have their Kleenexes ready there. And before I would do that, I would want to flush it with 10 mils of water just to make sure it's all clear and ready to go. Good. Okay, so now I would explain, now that it flushed well and it was good to go, I would unclamp the securing device here. I would also take the tape off his nose, and I would say take a deep breath. All right, we're going to pull it out in a twisting motion. Take it out. coiling it in my hand. All right, and it is all out and ready to be discarded. So I would help them clean up, get any kind of gastric contents or anything that came out of their nose, get that all cleaned up. I would document any relevant data, how they did with this procedure, any residual that came out, all of the consistency amount, if they were hooked up to suction, how much had come out already. I would document all of that. And that concludes my NG video. Thank you very much.